Hi friends, welcome to the channel The Nurse. Here we are discussing about blood alcohol test. This is one of the rare topic so many discussed. So we will discuss blood alcohol test today. So before going to the topic, if you are not subscribed to our channel, please subscribe. So we will start the topic blood alcohol test. Blood alcohol test, why it is important means nowadays there is a protocols, so during the accidents and all, so they will delay during the alcohol for testing the alcohol. So what are the important things while doing the blood alcohol test, so that we will discuss here. So what are the important things in the blood alcohol test? Before that, we are understanding the blood alcohol test, we need to understand some basic things what alcohol makes in our body. So that we will discuss it first. So first thing is alcohol depresses central nervous system when large amounts of alcohol enters the blood. So so many doesn't know what effect will make the alcohol in our body. Actually, it decreases the central nervous system activities. So in large amount, if you are taking means it will depress in our respiratory effort also, and usually we will lose our judgment capacity. If average amount, if we are taken some amount of alcohol, so it will reduce our judgment capacity. We will lose our judgment capacity to what is right and what is wrong. That ability we will lose. So according to that we will act. Next thing is alcohol is absorbed within a few minutes and peaks within an hour. So usually, if you are taken drinks, so the absorption of alcohol will start from within a minutes. So that maximum amount of alcohol absorption will be completed within an hour itself. So that will be a very important thing. So absorption time. Then, if you are taken alcohol along with the food will reduce the absorption rate. So usually the people will take alcohol with some touchings. So some side dishes will be there. So if you are taken alcohol with any food, so that food will reduces the absorption rate. Then alcohol, that main organ, that is alcohol metabolism is helped by liver, and the it is excreted after the metabolism. It is excreted through the urine and some amount through by our breath also. So first metabolism is by liver. After metabolism, it is excreted through urine and some amount of alcohol excretion through our breath also. Then blood alcohol test measures the level of blood in the level of alcohol in the blood. So alcohol test. So we are assessing the how much amount of alcohol in the blood. So that also depends upon the time of the test and how much amount of alcohol taken, and with along with the food or some other things. So that and all, it depends blood alcohol test. So that we will discuss in coming slides. Then in this picture you can see the alcohol breath analyzer. So that police and all using during the highway patrolling. So you can see this machine. So there will be change some other type of machine also coming. So just for a demonstration, I have given a picture. So this is one of the alcohol breath analyzer, and with that they will assess through your breath. So a breath analyzer that measures alcohol levels in the patient's breath is another test to determine the level of alcohol consumed by the patient. So during the highway patrolling and all, the blood test first and all, it is easy to do at during any persons. So first breath analyzer will do. So if any doubt is there means they can take the person to hospital for blood alcohol test. So it will confirm the result. Then the patient signed. This is very important. If you are doing alcohol blood test, there should be a consent, patient consent needed. If any legal implication happens means, so the hospital will be leaked. So there will be a written consent before doing alcohol blood test. So that is, you should follow the hospital guidelines for doing alcohol blood test. Then why alcohol blood test is performed? So there is different things. First thing is screening. Screening for first intoxication. So intoxication, if any persons comes to the hospital with some other difficulties, so the doctor is suspecting alcohol intoxication. In that case, we can screen with the blood alcohol content test. So the doctor can either consider person is intoxicated, or doctor can ruled out the intoxication possibility. The second thing is underlying cause of altered mental status. If the any acute altered mental status behavior patient is showing and without any proper reasons, so doctor may consider alcohol blood test whether it is induced by alcohol or not. So the second indication for alcohol blood content, that is to find out the underlying cause of altered mental status. Then the third one is ingested alcohol. So the doctor is suspecting if alcohol ingested or some other drugs. So you need to confirm whether it is alcohol or not. The doctor can perform alcohol blood content. If alcohol presence is there, means he can confirm he was ingested. The person was ingested alcohol only, no other, nothing else. Otherwise, a doctor can ruled out it is not an alcohol, some other thing he has consumed. So doctor can take further action. Then what is the nursing importance while doing blood alcohol test? The nurse should understand the result of the blood alcohol test represent the level of alcohol at the time of the test. So that is very important. If the alcohol blood test is doing immediately after consuming, or then the nurse will get an accurate report. If the time duration is increasing, the blood alcohol content also will reduce. So with the blood alcohol content level, the doctor or nurse cannot predict how much alcohol was taken, because the alcohol absorption will start from within a minute and the peak maximum absorption will be within an hour. So if it is taking more than 1 hour or more time to do the test, the result also will get a decreased amount only. So the nurse or physician cannot predict how much amount was taken, but the time of test, the patient's blood was in patient's blood, this much amount of alcohol was there, the nurse can tell. So that is an important thing, because the alcohol will be immediately metabolized by liver and it will start excreted through urine and through breath, so that we cannot measure. Then next thing, if any patient comes for alcohol blood test, the nurse should assess if the patient have taken sedatives, any kind of sedative patient taken, and any natural medication, plant medication, Ayurveda medication like kava, ginseng. These are the Ayurvedic medication to improve immunity, like that medications. If patient has taken, means it will increase the sedative effect of alcohol. Antihistamine for cold, cetirizine like antihistamine, if you are taken along with the alcohol, means it will increases the sedative effect of the alcohol. So nurse should ask the patient if patient was taken any kind of sedatives, like any anxiolytic, benzodiazepines, any herbal medicines like kava, ginseng, or any antihistamines like cetirizine. So it will increase the sedative effect of alcohol. Then patient need to ask whether patient has diabetic ketoacidosis. So for that, nurse can do a random blood sugar at the bedside with the glucometer. So nurse can assess the patient whether it is in a ketoacidosis condition, or patient can nurse can smell the breath. So through that, that peculiar smell will be there, fruity smell in ketoacidosis case. So that also will increases the effect of alcohol. Then they should also ask whether patient has taken methanol or isopropyl alcohol. So methanol, usually alcohol, that drinking alcohol is ethanol, ethyl alcohol. Methanol means it is a toxic. So nurse should ask whether patient has taken methanol or isopropyl alcohol. These are the toxic drinks. So if patient has taken methanol, it will cause life-threatening problems to patient. So nurse should ask or confirm whether this alcohol is methanol or ethyl alcohol or isopropyl alcohol. Then nurse has to check the vital signs. Alcohol ingestion, I told you, it will cause CNS depressions. So if more alcohol taken, then the CNS depression effect also will be more. So that will lead to respiratory depression. So vital signs is one of the important thing in nursing intervention. Then the assess the while taking the blood alcohol test, the nurse should clean the alcohol. The site is cleaned with alcohol. The nurse should wait for drying the alcohol or spirit. Otherwise, it will mislead the result. If nurse is using the alcohol or spirit to clean the insertion site, so nurse should wait for drying the alcohol or spirit. Then only the nurse should take the sample. Otherwise, it will give a false report. Then, while taking the samples, the nurse should take a safety precaution, because I told you the judgment capacity of the person will lose with the effect of alcohol. So he may be violent or aggressive or agitated. He will attack the nurse. He will not understand who is taking the sample. He will consider he is attacking. He is coming and attacking you. So he will be very agitated or aggressive. So nurse should take appropriate safety precautions while taking blood sample. And if that patient is too much alcohol is taken, his peripheral vision also will lose. Then the speed in which alcohol is metabolized is influenced by. So in first slide itself, I told you some things will be increase or decrease the absorption of alcohol. So what are the things we will see here? The speed in which alcohol is metabolized in the human body is influenced by, one is proof of each drink. Proof means alcohol content. So in some drinks, the alcohol content will be low, and some drinks it will be higher. So usually wine, beer and all will be lower content, and whiskey, rum, these alcohols have more high alcohol contents. According to the proof of each drink, according to the alcohol content, the higher the proof, the higher the blood alcohol level. If you are taken higher alcohol content drinks, it will give higher alcohol level in blood. Then next thing is patient's weight. If patient is obese or overweight, the alcohol content of that person will be low, because it will be diluted in body. So that is another thing. If patient is obese, the alcohol content will be low. If patient is lean, very thin person, means the same amount of alcohol will give higher blood alcohol content. So that is a difference. The same amount of alcohol is taken by obese patient and thin or lean patient. In obese patient, the alcohol content will be low because of dilution, hemodilution. Then in lean or thin patient, it will be higher alcohol content. Then another thing is number of drinks per hour. So I told you the maximum absorption will be within an hour. So the test is conducting within an hour means it will give a higher value. If any delay means that will give a lower value, lower blood alcohol content. So maximum alcohol blood content will be given if it is the test is done within an hour. Then patient's age also one of the influencing factor. If the older age persons will means there will be higher blood alcohol content because of there is less water content in body. So in younger and older patient is taking same amount of alcohol. The older patient have more alcohol content and is metabolic because his water content will be low and his metabolism also will be low. The liver is metabolizing alcohol, so that rate of metabolism will be low in older persons. Then amount of food. So that is the another factor influencing the rate of absorption of alcohol. If you are taking more food along with alcohol, the lower the blood alcohol content. So food also will absorb some amount of alcohols and it will reduce the absorption rate. Then women are having higher blood alcohol content when comparing to men, because in women body there will be lesser water content when compared to men, so it will give higher the blood alcohol content level. So these are the interesting factors which are in, the rate of absorption of alcohol influenced by these things: women and age of the persons and weight of the persons. These are the things. And another thing is, if you are using club soda, the soda will increase the or make faster the absorption. So usually the alcohol is diluted with soda or some other water. So usually soda will increase the absorption of alcohol. So these are interesting factors. Then what are the quick assessment the nurse should made during the time of arrival of the person? So first thing, if the blood alcohol content is 0.03 to 0.59 gram, so we can tell it is in milligram because it will be useful. So if the blood alcohol content is 30 to 59 milligram, what are the symptoms will show? So there will be increased talkativeness. The patient will continuously talk. He will not stop. Then decrease in inhibition. He will do the things without thinking, and there will not be a judgment capacity. I told you. So decrease in inhibition. Then decrease in alertness, coordination, and concentration. There will not be alertness. He will not listen you on what is doing, what the person is doing, and all. There will not be a coordinations. He will do without understanding what he was doing, and there will not be a coordinated effect. And if the alcohol content is little higher, that is 60 to 100 milligram, so in that condition there will be decreased reflexes. I told you vision also will lose, that is peripheral vision. So that is why the drunken drive is prohibited. Peripheral vision will be lost and depth of perception and reasoning. So these and all will lose when alcohol level is 60 to 100 milligram. Then blunted feeling. There will not be a proper feeling. For a happy thing, he will not provide an happy emotion, or during the sad situation, he will not provide an proper emotion. So there will be blended feeling. Then impaired sexual pleasure. So usually the sexual pleasure will be reduced if the alcohol level is 60 to 100 milligram, means the sexual pleasure will be reduced. Then if a little more higher, that is 110 to 200 milligram of blood alcohol content, then there will be staggering. The walking and all will not be coordinated, gait and all will be very improper way, and slurred speech. We cannot understand what he is telling. and a slurred speech will be there, and a decreased reaction time. He will react within a few time without thinking. He will react. The reaction will be time will be very less. He will act without thinking, and emotional things from happy to sad, this will be very fast. And over expression for anything happened means he will give an over expression, what is more than the required emotional expression. He will give a over expression. Then alcohol level is it is a high, very high, that is 210 to 290 milligram of alcohol. Then the memory will lose, blackout of memory. He will not understand, he will not remember the previous things and all. And stupor, sometimes he will not respond to any other stimuli. Then sometimes he will lose the consciousness. And impaired sensations, vision, touch, everything will be lost during the higher alcohol content, that is 210 to 290 level. He will lose all the sensations, loss of consciousness. Then very high level, that is 300 to 390, decrease in breathing, respiratory depression will happen. Decrease in heart level, that is CNS depression is maximum. Severe depression, then unconsciousness, and risk for death. In this condition, if you are not handling the treating the patient immediately, the risk of death is high. Then if it is more than 400 milligram, the patient will die. If greater than the alcohol content level 400, the patient will die. So that is about alcohol level and the symptoms based on the alcohol level. And then we need to, what are the things, understand if we are getting the result. The test result, it will get very quickly without a time delay. And after that test report, we need to see the control level and all. In control level, it will give whether it is normal or low based or high level controlled level. So based on that, they will give a report. So usually, what will be the normal range? In normal range, the alcohol level will be 0. So any report more than normal range, that is any alcohol presence, that is abnormal report only. So anything higher than the normal range, anything higher than the 0, that will be abnormal only. So according to National Highway Traffic Safety Administration, that is based on India, that is 30 milligram per deciliter is accepted. Less than 30 milligram per deciliter is accepted for driving or for drivers. If it is more than 30 milligram per deciliter, he will be charged, or he will get a fine or imprisonment. But in a European countries, this level, it is little higher, that is 8 up to 80 milligram per deciliter is accepted in European countries. But in India, it is up to 30 milligram per deciliter. That is accepted blood alcohol content, or through the breath analyzer, it will be less than 30 milligram per deciliter. Then other nursing implications, that is the nurse should perform the clinical institute withdrawal assessment for the patient admitted with alcohol intoxication. The nurse should perform the clinical institute withdrawal assessment regularly. The nurse should measure pulse and blood pressure. Then also check any nausea, vomiting, any tremors or tactile disturbance, visual or auditory hallucinations, sweating, anxiety, agitation, and disorientation. These are the symptoms of simple withdrawal. If we are untreated the simple withdrawal, he will go to complicated withdrawal and delirium tremens. It is the fatal condition. If it is untreated, delirium tremens is untreated, the patient will die. So nurse should regularly measure, assess clinical institute withdrawal assessment, and assess whether patient is in withdrawal or not. Then the assessment is performed regularly to identify when withdrawal symptoms appear, and track the severity of withdrawal symptoms until withdrawal symptoms are absent. So first nurse should start any withdrawal symptoms started or not. If it is started, the nurse should assess the severity of withdrawal symptoms till the absence of withdrawal symptoms. Till the withdrawal symptom subsides, the nurse should regularly observe the clinical institute of withdrawal assessment. Then according to law, according to Indian law, Section 185 of Motor Vehicle Act, that is modified in 2019, which indicates a permissible limit of blood alcohol content of 30 milligram or 30 milligram per deciliter in a test by breath analyzer. So according to law, the test is by breath analyzer. It is telling if the police person is having any doubt in that, he can take the patient into any hospital for blood alcohol test. The wording of the section is clear the necessity of the test by breath analyzer. The first the police person has to do breath analyzer. In that any doubt comes means he has to confirm with blood alcohol content. The police officer may also take the person to a nearby place to conduct a breath and blood test. So that is very important. So according to section 185 of Motor Vehicle Act and 188, if the blood alcohol content is 30 milligram per deciliter of blood, then does not amount any offense. So up to 30 milligram of blood alcohol content in 100 ml, there will not be any offense. If it is higher the value, more than 30 milligram per deciliter, it will attract an imprisonment of 6 months. Initially, it will attract a imprisonment of 6 months or fine up to 10,000 rupees. If the offense is a little higher or severe accident and all, then they will do 6 months imprisonment and 10,000 fine. Otherwise, either he has to go to imprisonment for 6 months or he has to deposit 10,000 rupees. Then, if the person is repeating the offense, same offense, drunk and drive, then within a 2-year period, then the punishment will increase. Within a 2 year, he is captured by police for drunk and drive again. Then the fine will be 15,000 and the imprisonment will be extended up to 2 years. Sometimes it will get both the fines, that is 2-year imprisonment and 15,000 fine if the person is repeating within a 2 years period. So that is about alcohol blood content. So if you have any doubt means you can ask in comment section. I will try to solve your doubts. So if you like the video means please share with your friends and click the like button, and thank you for watching this video. Bye bye.